Good evening, Cam followers. I'm joined this evening by the lovely Tamsin Durston. We're discussing this evening coping with the emotional side of living with a pet with osteoarthritis. Tamsin's written an amazing book of emotional well-being for animal welfare professionals, which has got some amazing tips in that we'll be discussing tonight. It's a really important subject, which I think it'll be good for both owners watching and also pet professionals in how we can support each other to create a really good management plan for all those pets out there. So I'll pass you over to Tamsin, and she's going to just introduce herself a little bit and tell you guys what she does.
Okay, well, thank you, Evie, and yeah, thank you for inviting me to talk to you and anyone else who might be there. I don't know. This is really scary. And I would apologise. I cough when I get nervous, so I might start coughing, but that's nothing.
That's right.
I was thinking nobody can catch anything because I'm just in my bedroom. But if I do start coughing, it's not COVID, it's just nerves. So yeah, thank you. And also, I think before we start, what I really wanted to say was also just thanks to Cam for like everything that you're doing, like Evie and Hannah and everyone Harry and everyone that works with you, because I think sometimes we don't say thank you enough and we forget to support each other, and that's just hugely important, like in our industry and like the dog training and behavior community and the veterinary community, and just to say like what you guys have achieved and having this dream and setting it up, that's such hard work. And I think Cam's stuff is so cool, and it's just brilliant to see how well that you've done. And I just wanted to say a public thank you on behalf of all the dogs and all of us. And so thank you very much for that.
Very kind. Very kind.
Because you might not hear it very often, and it's important that we tell each other, I think, when
definitely
believe in what someone else is doing. It's really like, I think if we're talking about emotional well-being, like one of the most important things that's been identified is feedback, and just feedback that somebody is doing something really well, and people looking after their pets really well. And I wonder how often we as veterinary professionals and trainers and behaviourists, and I've got all of those in my sort of qualification toolbox, I wonder how often we actually say to our clients, like, you're doing really well. Like,
yeah,
I know it's really difficult for you living with that reactive dog, living with that dog that struggles, living with a dog that you have to struggle to get out because you might have to lift them or support them or take special things out with you to manage your dog, or you have to drive somewhere now because your dog can't walk, and all those things you're doing make such a difference. But to have that feedback of someone saying to you, you're doing a really good job, because our dogs can't tell us that. They tell us in the way they behave, and they tell us in their response to us and the way they look at us, and but they can't tell us in English, but we can tell each other, and I think it's really important that we do that. But anyway, I've just jumped into it, but I'll just tell you a little bit about me so you know who I am. So my name's Tam. I'm a qualified veterinary nurse, registered veterinary nurse of, oh my God, 25 years now, which feels like such a long time. But I started out in veterinary nursing, and I worked with the most amazing nurse called Rachel Leach, and she's still practicing, but she knew all about cats and she knew about cat behavior. And I saw the way that she handled cats and the way they responded to her, and that made me think, oh my goodness, I want to learn about animal behavior. And so she inspired me to, once I'd qualified as a vet nurse, to really look at animal behavior, because I realized that if I could understand more about the way our animals communicate with us and tell us how they're feeling, that I could actually change the way that I approach nursing them and handling them in the veterinary setting. And that would have such a knock-on effect on their care, the way they felt in my presence and in the veterinary setting, and then their treatment. And so I went off and I studied like online distance learning from university. So I did a degree in companion animal training, and part of that training and behaviour counselling, and part of that degree covered talking to owners, counselling owners, because as a nurse or as a behaviourist, you're trying to influence an owner to make changes to their life and their lifestyle that's going to enable their dog to have a better life, whether that's medical, whether that's behavioural and training. You still have to understand how to connect with those people, and learn about yourself as well. And that degree, that was at Chester University, and that gave me such a foundation for wanting to learn about humans as well as animals, to make any interaction I have with anyone and their pet the best it can be. So once I finished that, I went on and got obsessed with behaviour, and I did another degree specialising in dog behaviour and training with some incredible people, and their dogs so inspiring, as well as the teachers. The classmates were amazing. And then after that, I've just finished a master's studying human behaviour, because again, you know, I really wanted to understand more about people and how to really understand the human side of dog ownership, and to connect. And that part of that was positive psychology. And at the same time, I was doing a practical philosophy course that really tried to help you sort of make sense of the world, of your emotions, how you experience life, the fact that we have a choice over how we behave in response to our feelings. And at the same time, I was, you know, doing my animal behaviour study. I was managing the veterinary team, the veterinary nurse team at Blue Cross Animal Hospital in South London, the most incredibly talented team of veterinary professionals. Oh, such a privilege to work with them. But it's such an emotional job, and it's so demanding, and it really opened my eyes to having to really try to create an environment where we all felt as if we could talk about our emotional health, talk about our well-being. Because if we're not functioning as a team of people, the care that we give our patients and the animals that we just love so much isn't going to be as effective if we're struggling ourselves. And so that led me to do all the research and take all of the knowledge that I learned doing all of that study and put that into this book for animal welfare professionals to provide loads of tips to sort of caring for yourself whilst you're doing such emotional work. Hopefully everything in there it's just really applicable to any human, really. Anyone.
Definitely. It's really helped me, because sometimes it doesn't matter how many good things happen in a day. If something bad's happened a month ago and you haven't properly dealt with it,
you hold it with you,
and you don't realise, and then you have a client who becomes emotional with you, and they get angry because they haven't got the news that they wanted to have. And you're just like, well, what are you having a go at me about? Like, that's not fair. And
then sometimes when we're in that state, we can behave hastily, and we can behave sort of driven by our emotions. And emotions are really important. It's really important we feel them. They have, you know, we need them to survive, because they make us aware, they make us experience everything that life has to give us. But if we can understand why we feel the way we do, and we don't have to act on those emotions, we can regulate ourselves and just temper ourselves so that we can get the best out of every situation, rather than do something that we then wish we hadn't done or wish we hadn't said. There's probably not anybody here who hasn't done or said something that we wish we could take back, you know. And we're humans, and that happens. But when we do that for our animals, we feel so guilty, and sometimes we have such a bias to focus in on all those negatives that can be really hard. It becomes a barrier to us ever getting over it and realizing that actually we are doing our best, and we've got to be kinder to ourselves.
Definitely that was a great introduction of yourself, and it's amazing how much you've done. It's amazing. So we'll start off this evening, I think, with talking about what sort of emotions we can see as professionals or owners might go through when they do have a diagnosis that they weren't expecting. So, for example, having a young dog that's been diagnosed with hip dysplasia, or so they've got to change things to prevent OA, or an agility dog that's just is going to have to be taken out of competition because they've got OA. How do you deal with that? What sort of emotions do you see?
Yeah, I think we see a whole variety of emotions, and I think it's really important to remember that sometimes we feel bad about the way we're feeling, and we should never feel that way, because every emotion you feel is valid. You're feeling it for a reason. So sometimes we tell ourselves, oh, I shouldn't be doing this, I shouldn't be feeling like this, I should be able to deal with this, and actually we're feeling the way we're feeling. So we can own those feelings, and see them as a platform to help us understand why we're feeling that way, and then how we move on from there. So I think really when you get, or if I've been involved in helping to communicate a diagnosis to an owner, it's very individual the way that people react. We often see sort of denial, and people know that can't be right. They look fine, and certainly when we're trying to diagnose pain and a dog, because dogs are so joyous and they're in the moment, it can be difficult for people to really believe the severity of the problem, because a dog might be choosing to run after their toy or leap around in excitement when we come home. And so there can't be anything wrong with them because they're running and they're jumping. But actually the desire to do that behavior overrides perhaps the pain that they're going through at the same time in that moment. But there's still wear and tear on the joint. So sometimes dogs look absolutely physically fine, and yet we have seen on an x-ray, yes, there is a very significant problem. So that can be an issue. We can have a little bit of denial or a little bit of confusion. Well, why, if it's that bad, why is my dog coming out for a run, for example? And so it can be difficult to get your head around. Then you get frustration, and you can be, I think really for me, I think it's panic, and I think it's grief, because you start to grieve for the dog and the life that you thought you were going to have with that dog. If you were wanting to do dog sports, or you were planning, I mean, my big passion that me and my dog love is we love to walk. And when we took our, I mean, Cokie, you might have seen her just come behind me. And she's just made a bed now. Well, I'm sitting in her bed, and she is now lying on our bed, so we've swapped places. When we first got Coco, there was a question that she might have hip dysplasia, and because I love to walk so much, I thought, well, can we take on a dog with a potential mobility problem? And we thought, yes, we can, because it's about her, it's not about me. And stepping aside from your own ego and your own plans. But that can be a very difficult thing for us to do, especially if we're competitive, and our social lives often revolve around, going to shows and having that sort of social life with our dogs, meeting up with other people, going off on workshops and weekends. And so you grieve for that, because grief is about loss, and you don't have to physically lose the animal to experience that grief. You can lose something that hadn't even happened. It was just your hopes and your dreams, and that's still grief. And that can lead you to be angry, to feel frustrated, and also to really sort of, sometimes there's resentment, like, why has this happened to me? You can take it very personally. You can feel as if you're being punished, perhaps sometimes for something that you've done or you think you've done, like, what? And you can think, why me? Like, why? Why am I so unlucky? And you can really focus on those frustrations, and all of those sort of emotions, I think, play into it. And what really interests me is that when we really study emotions, the grief emotion is really closely linked to panic. And I get that, because when you are losing something, it's that panic that you're losing control. And when your animal is diagnosed with something, you know, you're their owner. You're supposed to be caring for them, in control of their life, able to meet their needs, to give them the best life possible. And suddenly there's something that's out of your control. Yeah. And that makes us panic as humans. When we lose control, we panic. And that's tied in with grief, that feeling of sort of heartache. So it's a difficult thing. Like nobody, it's never going to be positive. Nobody ever goes to the vet thinking, oh, I'd love to get diagnosed. No, like, so it's always going to be difficult for people. And it's a lot to come to terms with.
Yeah. And I think at that point as well, when people are going through all those emotions, you've also got what's going on at home and financial struggles and things, especially at the moment. I mean, when we say to people that they're going to need to be on pain relief, we can do x-rays, we can do this, and that's just hundreds of pounds racking up, and it's panic for people on top of the grief they're feeling for their dog and things like that. So I think at that point, at the diagnosis, it's really key for both owner and professional to create that bond, because if that bond isn't made, then you're not going to get anywhere with.
No. And there's also guilt. I think, you know, if you feel that you can't, you know, I don't have a lot of money. No. my dog is insured, but insurance also might only cover a certain amount. And if my dog needed something beyond the cost of which I actually could manage, and that might limit my choices, I would go with the best choice available to me, but I couldn't help but feel guilty that I did have only a limited set of choices, and I couldn't choose what we might think would be the absolute best choice because I couldn't afford it. And I think owners, then we feel like we're letting our dogs down.
Yeah.
And I think we forget about all the things that we are doing for our dogs that are amazing, that our dog doesn't know that she could have an MRI, an amazing orthopedic surgery. She doesn't know that those options exist. In our dog's frame of reference, they know how they feel, they know who they trust, they know about their home environment, they know about their relationship, about things that they enjoy doing, about what we can give to them. And I think we can reframe the way we think and focus on what we are giving, not what we're not able to give, because that's beyond our control. So it's learning how to sort of really detach and almost let go of what we can't control and really focus on the things that we can.
I think it's a strange balance, because there's a lot of time that we put a lot of human emotions onto a dog, and you forget that they don't think the same way as us, and they don't sometimes feel the same way that we would feel about certain situations. And so we have clients that are like, oh, well, they're not going to be able to do their favorite ball game anymore, and I feel guilty because of that. But then they're like, but I don't feel like they're in pain, and they're late, they're like 10 out of 10 lame. So it's strange how they can feel an emotion for like the ball frame, but not feel it in that way. So I think it's important to see it from all aspects of like the owner's view, and also our side of it as well.
Exactly. And I think the biggest thing for the sort of healthcare professions, whether that's veterinary, whether that's trainers or behaviourists, physiotherapists, groomers, anybody, walkers and dog sitters, anybody who's working with dogs, it's really just to have that empathy for the client, because I think, as well as being a veterinary and behaviour training professional, I'm also a dog owner. And when my dog's at the vets, all of those professions, they've gone. I am the vulnerable person. Coco had a booster last Friday, and I was in the vets like, and we're human beings, and that's what connects all of us. So we can really empathize with our owners, and actually, you know, it's recognizing that people always try to do the best for their dogs, but what what they are able to do, what they're physically or psychologically capable of giving their dog might be different to what I would do or what someone else would do. And I think one of the biggest things that we can all learn, whether we're the dog owner or whether we're the professional, is that we should never compare ourselves to anyone else. Like, our relationship with our dog is completely unique, and it's beautifully unique, and it's wonderful. But we often look at other people and I think we get this sort of sense of, oh, well, my friend's dog had this and she did this and she did this major surgery, and so I have to do the same. And or people would look at us and expect us to be doing a certain thing. And it may be something that perhaps we don't agree with, or we're not sure about, or it's going to break the bank, or we're going to really struggle because we agree to it because of peer pressure and or what we feel is society pressure and expectations on us. And so my feeling is that we should all really just concentrate on us and our dog, like you and your dog, and what is best for you, and that will be different for everyone else. So we can't compare, we shouldn't as professionals, we shouldn't set owners up and think that, you know, there's any one sort of gold standard. It's everyone doing the best with their situation. That's all we can ask.
Every dog copes differently to different treatment options. Like some dogs might love hydrotherapy, other dogs might hate it, so it might create different recovery. Whereas it's just not appropriate for some. They might have exactly the same injury, but it may not work for some.
And also some people have different resources and abilities and things that they can physically cope with, and that's okay. And what we really want, I think, and this is where our relationships between owners and the professional team and the dog, it's that sort of triangle where we need to really have these really open and honest and empathetic relationships. Because I had an owner once whose dog had osteoarthritis. They were really struggling to get up if they needed the toilet, so they were making a lot of mess in the house. And the owner waited for the vet to go out of the consult room and then said to me, the nurse, I just want a house that doesn't smell. And I said to her, do you know what? You're allowed to want a house that doesn't smell. Nobody wants a house that smells of wee. Like, nobody wants that. And that's okay for you to feel that way. And it's okay for you to say that. It doesn't make you a bad person. It just means you don't want a smelly house like the rest of us. It's normal. It doesn't mean you don't love your dog. No. And she said, you know, we know when we do say goodbye. She said, my son's going to buy me new carpets, and she said, I don't ever want to say goodbye to my dog, but I really want new carpets. And I'm like, but those two, you can have those two thoughts at the same time. And that's fine. And I appreciate you telling me, because I get it. I understand. Because you're a human being, and we would all feel that way. But the fact that she could be so honest is really important, because I knew that conflict. And I think when we're caring, when we are caregivers for animals that are suffering in some way, we do feel that burden. And I think that's something I cover in the book. It's, as professionals, we're faced with what we call moral stress, where it's the ethical dilemma of, is this the right thing for the dog? Is it the right thing for me? Am I doing the best? And we just, it's such a burden. And it can just make us feel so pressured that we struggle under that burden. And we can lift that burden from ourselves by sort of, you know, looking and saying, okay, yep, I do feel that way, but what can I do? And how can I do my best to meet my dog's needs now in this moment? And, you know, by talking about it and sharing, you find out other people feel the same. And
definitely.
And then you can bring a bit of relief in, and we can share that load.
And I think being honest, but both a professional and an owner in the whole situation. Say, if someone say to you, right, I need you to be doing this exercise 3 times a day, and I need this medication given at this time, and then on every Friday you have to do this and this. And the owner's like, I can't do that. I work full time. I've got 8 kids and I've got 6 horses. Like, everyone's got stuff going on. If you can't do it, it's just say that I can't. There's other options. There's never just one option. And we'd rather to work as a team and do the best for your pet. We need to work as a strong unit and balance each other.
I think one of the really progressive things, certainly about the veterinary nursing profession, is that, 25 years ago when I first started working in practice, the profession has advanced so much. And now when I'm sort of teaching student nurses, I've been so fortunate to have been involved in student nurse training, but we now teach nursing care plans. Yeah. And this is about having a real holistic approach to care of the dog, the patient. Yeah. And that involves the owner in the care. And if we have a newly diagnosed dog with arthritis, to actually sit down with the owner and talk about, what's your situation? Like, what kind of house do you live in? Do you have stairs?
Yeah.
How physically able is everyone in your house? Can you lift your dog? Do we need to think about how changes you could make to your environment to help your dog out? Do we need to think about putting yoga mats down? What can we do to help you in all areas, so that when there are days perhaps when you don't have your grandson visiting and he's the one who can carry the dog into the garden for you, you yourself can do something different to keep your dog entertained, or to bring different smells inside, or to do different things. But let's look at your diary, your environment, your physical capability, the other demands on you, and let's come to a plan together that you are going to achieve. Because something that I think we all need is this idea that we are helping. I think we often we feel we're letting our dogs down if we don't feel we're helping them.
Yeah.
And I think as dog owners and as a professional, what I really want to do is to give an owner something that they can achieve. And if they can't achieve a full hydrotherapy or physiotherapy session, they can't afford it, or they can't get there, they can't drive, for example, what can they do at home that might be helping? Is it just gentle manipulation of the joints to lubricate the muscles? Is it a hot water bottle wrapped in a tea towel onto their dog before they get their dog up and take them for a walk to warm the dog's joints up? What little things can they do so that we're feeling as if we're making a difference and actually doing something, rather than just watching and thinking, I'm rubbish, I'm not helping my dog, I'm no good to them. And then we start to believe that we're not any good, and that's not true, because being there for our dog is the best thing we can do.
And also they pick up so much emotion from us. So if we're feeling down and you're out on a walk and you're just like, oh God, like, okay, I just can't cope with you walking so slow, or they're gonna lose that enjoyment because
we're not happy.
Yeah, exactly.
They can read us. Dogs are they are experts in us, in body language, and they know. And it's not that we need to hide our emotions, but we know that if we're really stressed and worried, it can have an effect on our dog. But then that makes us even more worried. And so, I think making sure that we've got the opportunity to sort of let our emotions out, but in a really safe space that perhaps doesn't expose our dogs to that. And then we can, because we all need that release. And it's really important that we don't bottle it up, that we do talk about it, like support networks, Holly's Army, your local vet practice. And also I've got to give a shout out to the Blue Cross bereavement support line, which is run by volunteers, and it's free. You can ring them, and you can even ring them. You don't have to be physically grieving and have suffered the bereavement. You could be grieving for the dog that you thought you were going to have, and you can still talk to a trained counsellor about that and get that emotion out and get some professional support for you. And you can do that without your dog around, so that when you're with your dog, it's about you and them just having the best time together.
And I think it's important to think. I think a lot of people think, oh, because arthritis is a word that gets thrown around, like you get old and you get arthritis. So I think sometimes people might feel silly that they feel that pain and they feel that shock. But I think it is important. It is a diagnosis. It's a life-changing thing for you and your dog.
And it can't be reversed.
No.
It's not a condition that your dog isn't going to recover from arthritis.
No.
It's a lifelong condition. And that's a lot to get your head around, because it's a diagnosis that now means you and your dog are going to live with this for the rest of your time together. So it's going to change everything, but it doesn't have to mean your dog is defined by that diagnosis, and your dog is your dog and can live the most quality life. It's just going to be a slightly different life to perhaps what you planned.
Exactly.
I think there's a whole school of philosophy that and psychology, positive psychology, that looks at how we frame things for ourselves, and and how we think about something can really affect our ability to take steps with our own behavior. So if we're feeling as if, well, there's nothing I can do, it is what it is, and I just have to accept it and go along with it. If we're in that mindset, then we're much less likely to actually do anything additional, which might help. Whereas if we have the mindset of, okay, I can make change, I can make things happen, this is a growth mindset. And if we have that growth mindset, and this takes practice, you have to practice doing it, because we get good at what we practice. So if we just always practice thinking negatively, we get really good at seeing the bad stuff. If we practice saying to ourselves, okay, I've got a choice here, what can I do? I can reframe this, I can see this as an opportunity now to get creative, to think, how am I going to enrich my dog's life today? What can I do differently to give them a new experience that they're going to really enjoy? And I think we so often think about dogs as being animals that love to run and leap around and jump, but they are animals who love to sniff. They love to explore. They love, well, I mean, each of our dogs will be different. That if we think about the things they really enjoy, what can we bring into their life? New smells, new experiences, and give them that might be a completely different experience. But we'll only do that if we believe that we can do it, and if we have that mindset of, I can make changes and I can do it really well, with the support of my veterinary and behaviour and training team and my groomer, and we can all work together as one to help make this dog's life the best it can be.
And I think going through change and things like that, I had a lady come in, she was really deflated, and she was like, oh, we're trying everything, he's on pain relief, and I'm doing everything that I can afford. And we started talking and spending time, actually I was like, right, write down what you do in a daily routine. So this lady lived at the top of a hill, and the hill was very steep, and her dog, they had a flat road this way and a hill this way, and they always used to go down the hill because he loved the river. And the dog would get down to the bottom and then become lame and be limping and then struggle coming back up the hill. And I said, well, why don't you try going on a walk 4 times a day, but on the flat bit for 5 minutes? And she came in 2 weeks later and said, I'm so happy because I don't see my dog in pain, and the dog was so much brighter and happier. And then it all coincided that she then put more effort into helping him to lose weight, because she was seeing results from changing his exercise plan just that little bit, instead of taking him down the hill when it was making him sore, that it made them both so much happier. So I think It's not bad. And she was like, I look like an idiot walking for 5. My neighbours just see me popping in and out of the house all the time. But
so what, you know, and but that's another, like, that's such a beautiful example that you were able to like help that lady think outside the box. Because but it just speaks to me volumes that she was worried about what people thought. And again, like in the training and behavior world, sometimes we're advising an owner, your dog really doesn't enjoy going to the park. It's scary. They don't like it. You don't have to take your dog to the park. And people are like, what? You're giving me permission not to take my dog out? I'm like, absolutely. Your particular dog don't want to go out. They're fine. You can do all these different things, and we'll slowly teach them that the outside world's okay. But actually giving people permission, but people are so worried about what other people think. And I think that's really particular. There's a lot of emphasis on that when a dog is clearly struggling with arthritis. And my example is of our old dog Lelky, who had arthritis towards the end of her life, and we had her on holiday. We were in Devon, and we were walking along, just very leisurely, taking her out for a little potter. And she was sort of very stiff. And, somebody came over to say, oh, I think your dog should see the vet. And she was on medicine, this was my dog. She was fine. And I was like, oh, thank you very much. Yeah, she's, we're looking after her. Don't worry. Very kind of you to come and say. And she walked away, and my husband was like, how dare someone comment? And he was like, but you handled that really well. Like, you were really calm. He said, I would have, in a charming way, I would have been really cross that somebody felt they could comment. And I said, but her intention was to be kind. And but when you're the person, and perhaps I'm sure many people with arthritis, just in one walk, maybe around the block, you can have had 10 people look at your dog and go, struggling today. And all of that stacks up, and we're all vulnerable to this trigger stacking where all these sort of comments and looks make us, and you want to say to people, I'm doing everything. She's looked after, she's got boots, she's having injections. But getting cross and it's just that emotional outburst, but it's that frustration of, I know she's struggling and I can't change it. And we all feel that. And I think that's really, I'm getting emotional myself now. But and that's fine, because it is emotional. We're right to feel that way. But I think it's just, for owners, it's very difficult when you feel judged. And that client that you were talking about obviously really felt judged. And again, that comes back to remembering that it's you and your dog. And you have to learn to accept that everybody will have an opinion. Some people will just offer it to you. But actually learning and practicing just saying, oh, thanks very much, appreciate your kindness. But if you practice that, like I practice, I was able to say it to the lady who came over to tell me that my dog needed to see that. I was able to say it and then just move on and not let it affect me. But I think that's another really valuable lesson, is just, we talk about sort of having if-then plans. And these are, we use them a lot in the behavior world if we're dealing with a dog that has a behavioral problem. So I might be counseling an owner of a dog who struggles with other dogs. If you are out walking and suddenly a dog appears around the corner, you will turn away, lead your dog away, cross over, give them treats. And you can practice that without the dog, so that when it happens for real, you've got the motor skills and you've got the psychological skills to feel confident doing it. But we can do the same with dogs with mobility issues. We can think to ourselves, if my dog falls in the street, I will always carry a bag now with me with a towel to slip under her to help her up. I will put her boots on her. So, or if my dog, if somebody approaches me to offer me help, I will very calmly say, oh, thank you. We've seen a vet. We've got a brilliant team. Thank you so much. And I will walk on. So just by thinking of all the possible situations that we might find ourselves in with a dog who has a chronic painful condition. They may fall, they may get stuck somewhere. You may be out on a walk and you have to stop for 5 minutes. You might need to call someone to help to come and collect you. But if you've thought about those and you've got those what if plans in place, you can even have them written down, then you won't panic when those things, or if those things happen. And that's another tip as well, just to help you be prepared to deal with those situations, because the better prepared we are, the less panic we have, the calmer we can be, and that helps our dogs.
Definitely. And I think also by, like you said, writing down a plan, a lot of our clients, we get them to use the Good Day, Bad Day diary that is one of our resources on our website. And I think by that, it gives your pet professional like an idea as to what is going on at home. But also, if you look at that diary and you're like, because you remember bad things more than good things, don't you? And a lot of my owners, if they haven't completed the diary, they'll be like, oh, they're just bad, like they fell, and then they were like limping on a walk, and they just can't think of anything good. Whereas when they complete the diary, they can see that actually there is a lot of good days. Yes, you get the odd bad, but then they're like, oh no, we can work with that, because there is
it's outweighed.
And I think because you do remember negative things more than the positive things. So I think by writing things, even if you just write it in your diary and put, today they were able to walk for 15 minutes rather than 3, like, it's fine.
Sniffed a tree. Found my dog finds apples in the gutter and enjoys eating them. You know, scavenged half a sandwich someone had dropped. That's a really good experience for a dog. And there's something about the act of writing things down. So this was, I mean, I love the fact that CAM offer that, you know, and it's there and it's in the resources for people, because one of the things that there's a positive psychologist, Martin Seligman, and he's actually called his sort of nickname in the psychology world is the father of happiness, which is such a lovely nickname, because he's really studied happiness in great detail. And one of the big things that he has studied and has published is that actually the act of writing things down pays off in terms of how the effect it has on our emotions and emotional well-being. So his advice is all about gratitude and writing down every day 3 good things. And it's the idea, and I thought about, you know, you could do this specifically for your dog. So have your notebook by your bed, so that when you get into bed at the end of the day, you just write down 3 good things every day that perhaps you and your dog did, or 3 things that you are grateful for that day that relate to your dog. Like, I'm grateful that my dog really enjoyed, you know, getting to sniff whatever I brought in a load of leaves from outside and put them down and my dog got to sniff them. Or I couldn't get to the river, so I filled up the washing up bowl, put it on the kitchen floor, dropped my dog's tennis ball in it. Oh, she had a great time getting it out of the water. Just these little things. Or I sat down with my dog for 10 minutes and just sat and just looked at her and thought how gorgeous she is. And we had that 10 minutes just sitting together, listening to her favourite songs, you know, and just being together. And you'd write that down, but actually the positive feelings you get from that, if you've written it down, last so much longer than if you just think it, which is brilliant to know, because that's something we can all do. It's really easy.
Definitely. And I think that's definitely a point that people should take home today. If that's the only thing that you do, it
will make a difference. And then you can pick it up and you can look back. And you can be like, oh my God, look at all this stuff like that we did, that we enjoyed together. And it helps balance out those negative bits that we tend to get stuck on.
Definitely. I think with everything, if writing those ideas down and keep it, if they can hold on to some, it's almost like holding on to something, isn't it? That you can see, because the negative times aren't good, but the good times are. So it's definitely thinking of that. I think also people do struggle with having like changing things, but like you said, by bringing like the leaves inside, or if you can't get to the river, filling up the bowl of water, things like that, it creates new memories. So I think that's what with people with dogs that get diagnosed with arthritis, it's creating new favorite things. A lot of people are like, oh, well, I can't throw the ball for them anymore. It's like, you can't throw it, but you could roll it just a little bit, so they can, or let them carry it along the beach. Most of them just carry it along in their mouth anyway. So it's creating new memories and new things that will release the endorphins.
Yeah, and also remembering that one of the brilliant things about dogs is that they're learning throughout their whole lives. And actually, a dog that might not be able to go out for a run, you could be indoors with that dog and you could have 20 different toys. I mean, I'm sure all of our dogs have got more than 20 toys. Can we name the toys? If I say to my dog, where's Teddy? She knows that Teddy's different from Mr. Piggy, Mr. Fox. I mean, she has a lot of animals. This is something that you could do. And actually talking to your trainer about, you know, what sort of things can I teach my dog, and teaching a chin rest, but can they put their chin on your hand? Can they put it on a box? Can they put it on a book? You know, these are things that dogs can do even if they're lying down. And then also introducing training around cooperative care. So if your dog is going to have to be sort of manipulated or massaged, can we introduce that in a really, you know, positive way with the help of a trainer or behaviourist to make it the best experience? Is it worth seeing a physio and things like TENS machines and other things that we can do, massage, to really help our dogs, but introducing that in a fun way and doing that in different places in the home as well, and on different beds and various things. So teaching our dogs to use a ramp when they're first diagnosed, so that, because we know arthritis can be a progressive disease, you know, teaching them things early on so that should they progress to that point, they're not scared when they're really vulnerable and stiff. They've already learned to use a ramp, or they can still get themselves onto the bed, you know, where they're comfortable, and so things don't have to change as much. And again, it's about thinking ahead and sort of future proofing. You know, do we introduce a ramp into our house if we can, to help our dog get in? Do we teach our dog, especially if we've got a big dog, to enjoy stepping in into a buggy and being pushed along, so that can give them more opportunity when perhaps they're older and they can't walk to the park. But if I can push them to the park, but they're happy and comfortable in the buggy, that's going to be much better to teach them before they get to the point where they're stiffer and more vulnerable and perhaps more painful, or more worried, more anticipating it to be painful, even though they're now on medication, that they don't want to get into the buggy in the first place. So just thinking ahead, but making these new training experiences really positive for dogs, saves you that anguish later. And also, again, not comparing and not feeling judged if you're pushing your dog along in a buggy so that they can get to the park to sniff the grass, stand on mud, you know, walk on different surfaces that you maybe don't have at home. That's fine. Other people will. We can't control what other people think. We can't. We can try to influence what other people think about us by, you know, explaining why, and you know, by being, you know, cool and polite and upbeat, but we ultimately can't control it. So let's let that go. You have to practice letting it go, because it's not easy. It doesn't come naturally to us to not worry what people think, but ultimately it's you and your dog. And if you feel you're doing what your dog needs, then fair play to you. Your dog will tell you. Your dog is the judge of that.
Exactly. I like this comment. Love this. Oh, dogs can definitely learn new tricks.
Yes,
For any pet professionals out there that are listening that think they they find it hard delivering the news to people that their dog's got arthritis, and they find it hard if the owner reacts in like an anger way or a grief way. They find it hard to deal with that situation. What advice would you give to them?
I think, and that's difficult, because as the sort of professional, you can empathize with the owner's feeling. You understand why they're feeling that way, but sometimes you can feel as if it's your response. You can feel as if they're redirecting. I think we've all done this. We will have all redirected frustration to somebody else and then said, I'm sorry, I know it's not your fault. I know this is nothing. You didn't make the train strike happen, but you're the one that I'm venting at. Or that you just happen to be there whilst they're expressing that emotion. And it can be really difficult to witness, because in these professions we see a lot of it. And this may be your sort of to the client, they're being told this for the first time, but as the professional, this could be the 7th or 8th person that day you've had to give some devastating news to, or some sad news, or some news that they're going to struggle with, whatever it is, something they don't want to hear. And when you're doing it again, that all of those things stack up. So for veterinary professionals, it's really about understanding the effect that the work is having on you while you're doing it. And lots of us, if you're fortunate enough to work in a practice where there's a larger team that you can swap in and out. So when I worked at Blue Cross Animal Hospital, we had a rule where if you were involved in a euthanasia, you wouldn't do more than 2, straight up, because it's just it's so emotional. And actually it's about protecting yourself and seeing, is there somebody else who could talk to this owner so that I'm not exposed to those triggers. You may not have that luxury, and in that case it's about really having a support network, whether that's somebody that you can phone and talk to, whether that's there in the veterinary community. We're very lucky, there are lots of things like Vet Life and Mind Matters where we can access support. For trainers and behaviourists who might be working by themselves, you can feel very isolated. So building a sort of a community through your own social networks can be really helpful, so that you can have somebody that you can just talk to and just say, look, I just need to have a cuddle, or a virtual cuddle. I just need to hear some kind words. And actually also on the other side of that, keeping that sort of diary, maybe for your work, about the things that you're grateful for, the things that you did that day that made a difference in a positive way, because we forget those. So if you come out of that consult and think, okay, I had to give that news, the owner didn't cope well, but I didn't let them leave before making sure that they had some skills to deal with their feelings. They had a helpline to ring if they needed it. They knew that they could contact us, and they had 2 or 3 things to immediately implement for their dog. So I was able to give that owner something, and that reminds us about the meaning and the purpose that we have in our role. And that's where we get the sort of satisfaction from our job, the compassion satisfaction, rather than the compassion fatigue. So we can reframe it for ourselves by remembering and reminding ourselves of those good points.
Definitely. And it all comes down to working as a team, doesn't it, and supporting each other, and being there to be like, that must have been hard for you, and let's talk about it, let's go and have a cup of tea, because it is hard, and because you're taking on the owner's emotion, the emotion that you could have a dog at home yourself that's got osteoarthritis and they're in a really bad place, and you put that onto it. I think because we do care about them so much, don't we, even if they're not our own, you put previous feelings onto things.
And you just you want to make their lives better. And sometimes that perhaps the owner's choices are limited because of their own situation. And it's also that acceptance that actually that's not your responsibility. Like, you can only give so much. You can't go and live with that dog and, well, I'll do the physio, I'll massage the dog 3 times a day. If you can't do it, like, you can't do that. So we have to accept the sort of limits of our role. And also the owners are trying their best as well. And that we are working together. And I think that's where those sort of nursing care plans come into their own, because you do work out actually what are we all capable of? What can we offer as a practice? Because we may not be able to offer all the services. You know, sometimes drugs are difficult to get hold of for manufacturing reasons, and they go out of stock, and then we can't deliver that next piece of treatment, and we're like, oh no, the dog's going to miss out on this, and then we feel responsible. And but again, it comes back to what can we control? How far does our personal responsibility reach, and actually accept that, and acknowledge what the owner is doing. It may not be what we would do if this were our dog, but they are still doing stuff, you know, and that's brilliant. Like, they're doing what they can do, and just reminding ourselves to really, again, practice looking for those really positive parts of this dog's care, and actually look at the dog. Like, is the dog having experiences every day that they are enjoying, that they are having this quality of life moments, and what are those experiences, and what else can we think about that dog could enjoy? And let the dog be the focus. And I think that helps as well, because then we get that meaning and that purpose back as well.
Definitely. I think we've got a comment from Caroline saying it's very difficult to have these conversations in 15-minute consult times, so you need to address this when booking. Which is definitely that. I think also using your nurses. So if you're in, I mean, everyone's short of time, everyone's short-staffed at the moment, but people can come back a lot of the time. Hannah will speak to the clients, and she may not have the time to spend an hour with them, and some owners need that time, so she'll then book them in with me, and I can spend that time with them. So it's working as a team to create that, and also sharing the emotional load.
And also, and recognizing that we have really skilled reception staff as well, who really care, who are really passionate, who can learn all about the condition, who can learn about counselling, who can learn about client care, you know, if they haven't got those skills already. And, you know, that again, it's the whole team approach. And we have some incredible veterinary receptionists who are so prepared to talk to owners, and very often it might be an owner who phones the practice who does end up just talking to the receptionist. And you know, we're very conscious that there are other people trying to phone, but booking telephone consults. And if it is about counselling, you know, can we set up groups within vet practices? Can we set up you know, there's a lovely my friends used to run a dog training centre where they had a social walk for golden oldies sort of regularly, and that became a group of people, all with older dogs, who would regularly meet to go for like a bimble, just let the dogs potter and have some social interaction with other dogs. This would be for dogs that enjoyed that. Let them sniff around, and let those owners talk to each other and share their experiences, but with one professional there as well who could give advice. And that's a really lovely thing that you can think about offering as professionals. Where we're bringing people together, and then you're talking to all of those people in one go, and they're sharing stories, and there's nothing like that sort of shared support where you know that someone that you really identify with is going through the same thing, and you might get ideas off them. And even if there's nothing else that they can tell you that you're not doing already with your dog, it's just nice to know someone else is going through it as well, and you're not alone.
Definitely. It makes you feel almost better that you're not, because you do, if something bad happens, you're like, I'm the only one in the world that's got this right now, and you're not. And find people, you use different resources that are out there to speak to people and discuss, because you also get ideas. It's like you said, when you're I've lectured before, and you pick up so many tips from different people about how they do different little things, and picking up tips. Like one owner came in and they came up with this new game for their dog, and then loads of it. And so it's or
even things like, you know, soft, you know, whenever I go on a dog training workshop with my dog, I find myself looking at everyone else's clothes like, oh my God, those boots, where that coat's waterproof. I want one of them. Whereas actually for people with, it's the dogs, you know, what's that hoist, you know, what's that harness you're using? And I know CAM, there's a lot of these sort of available through CAM, but actually seeing other people use, oh, is it easy to get that harness on because your dog looks really comfortable, and just talking about those kinds of things as well. And it's just sharing. And that's a very human thing, and telling stories, it's very connecting. I think when you have a dog that's diagnosed with a chronic condition, it can feel very isolating. You feel very cut off, and you can feel very disconnected, and because you just feel like, oh, me and my dog against the world. But actually it's every dog. Like arthritis is such a pervasive, you know, it's such a common condition, and the way that dogs' body shapes are, like anatomically, you know, the strain that our human society puts on them through the way that even our stairs are designed. It's not natural movement for a dog to be going up and down stairs, and but they do it because they live in our world. So you know, it's up to us to redress that and do what we can, and share what's working, because it could help someone else's dog.
Definitely. We've got some lovely comments and stories coming in, so if anyone else has any questions, well, if you could send those in, because we are slightly running over, but that is fine.
Sorry.
No, not at all. It's been great.
I have no idea what the
We've got a lovely comment here saying, my old girl has arthritis. We've been on so many adventures, climbed mountains, long hikes, holidays, agility, etc. I now get so much enjoyment from watching her sniff everything on our pottering walks, and she loves her hydro. It's not as exhilarating for me, but it is no less enjoyable. And
exactly. Like, there's nothing better than seeing a happy dog. Like, dogs are so expressive, and even a dog that perhaps hasn't got full mobility, just that expression of joy that dogs give us, like, doesn't that make you feel good to see it? And I love that person had said about sniffing, because I think nose work, and this is something I did a lot of with my old dog Lelky when she was sort of in her older years, and she didn't need to be able to run or jump, but just that when they're looking for a certain smell that you might have hidden, whether it's their toy or whether you've taken it further and introduced a specific scent, it activates this dopamine system. And this is chemicals inside the dog's body that make them feel good. And when they're searching for that scent, especially, it could be you've hidden a piece of cheese, for example, or a sausage. But when the dog is searching for it, that system, that reward seeking system, is activated, and it's buzzing, and the adrenaline they get, and then when they find it, wow, then they get to consume it, or they get to, wow, I found it, and then you can do it again. And that just that can be an addictive feeling, and that can enrich their life so much. And they've got to eat, so you could just scatter their feed every day. And it's such an easy thing. And there's so much joy from seeing a dog who is literally, you know, I was on a scent work weekend a couple of weekends ago, and the teacher said, dogs are scent machines. And so when you see what is essentially a scent machine sniffing for scent, it's pure joy. And it's so easy for owners to achieve. And that, if an owner hasn't thought of that before, because they may not, you know, that's a gift we give them. It's a gift to say to someone, do you feed your dog? Just scatter, hide their toy. Have they got a favorite toy? What happens if you just drop it behind a cushion? Can they find it and get that? Oh, I found it. It's a beautiful feeling to give a dog. And that's a gift we give them, because the gift that they give us is it's priceless.
We've got a question here from Caroline saying, frequently get owners, especially in rural areas, saying they're just getting old and don't comprehend pain. Any tips to convey this without preaching or making them feel guilty, as they haven't recognised the pain?
Yeah, that's such a good question. I think it's really difficult because there is this whole sort of cultural thing, they get old and they get a bit stiff, and we've probably all felt that as well before we became as knowledgeable as we are. So I think it's a natural feeling, and I think it's really important when we are almost challenging someone's belief. There's a lot of evidence around if we just come out and say, well, no, that's wrong. Actually, let me tell you about pain. And that's going to make somebody immediately feel vulnerable, feel challenged, and get their defenses up. So I think the thing to do really is to acknowledge and acknowledge their feeling and say, oh, yeah, they are getting old, aren't they? But have you thought about this? And just try to not challenge them directly, but present and say, let's reframe it. Let's think, okay, they are getting old, but what do they enjoy about life? And actually, if you think about their longer term care, there are lots of things nowadays that might enhance or enrich their life a bit more. One example, and talking about pain specifically, one example I often use with people is the example of a blister, because I think this is something that's happened to all of us, where you might have been out walking, you've got new shoes on, you get a blister, but you carry on with your day. Maybe you're walking with friends, whatever you're doing, even though your foot is really sore because there's a blister, because you have to get stuff done, or you're out with friends and you're having a really nice time, you carry on. It's how many people go dancing in very inappropriate shoes, but they stay out dancing all night because dancing is really good fun. And you think, well, I go on dog walks where I get a blister if I've got new walking boots, but I carry on. Despite my foot, like I take the shoe off and I've got this massive water blister, and I'm like, oh, well, really sore, but what a great walk. And so we've all overridden pain to have an experience. And we can just say, look, have you ever done that? Well, that's a bit like probably what your dog's doing. And actually, humour me. Let's try perhaps giving your dog's legs a little rub before they start. Let's see if that makes a difference, and actually slowly start to show them that things could be different rather than tell. And I think that's just a sort of gentle way of trying to change their mindset, and just saying, oh, they are getting old, but if you could do something about that, would you be interested? Like, what would you like to do? Would you like to? And then get them. There's a whole sort of school of philosophy called motivational interviewing, and that's about trying to influence someone else almost to come up with the solution themselves. Because when we feel as if we've got the answer, it's sort of stronger. And so try to get them to come up with it by saying, okay, so they are old and they are stiff, but do you think you could do anything about that? Have you tried that? Oh, no, I haven't. Maybe I could try. Oh, and then you come in and go, oh, that's a good idea. I've actually heard someone else has done that, because that's another technique, is that when we believe that someone else who we identify with has done something, we almost believe that we can do it. So by using an example of someone who's really just like them, so if you're talking to an older person, maybe say, oh, my old neighbour, was in the same situation as you and they did this, or that can really help as well. It's almost like when you go to a dog trainer, if the dog trainer says, oh, give me your dog for a second, I'll show you, and now you do it, you don't give that person any self-belief, because they look at you and they're like, well, you're a dog trainer, of course you can do it. I don't identify with you. But if they see another owner in the class doing it, they think, okay, maybe I can do it. So using those approaches might help and have more effects than just saying, don't be silly, of course your dog's in pain, because that just makes somebody feel bad.
Exactly. And I think, Lynn, thank you for putting this on. Our CAM Advocate Level 1 has got a section on how to communicate with owners and how to put things across. So yeah, if you are struggling, it's a great course, and it's really helpful. And like also Lynn has put a link into the thread for anyone that's listening that isn't part of Holly's army, but would like a bit of support. No question is silly, and there is professionals on there helping to guide it, but also pet owners that are going through the same situation, that come up with hints, tips, and ask questions themselves that you might be too nervous to ask, but someone else has asked it for you. So thank you very much, Lynn, for popping that on. Well, that was a love round off for the evening. Thank you so much for joining us, Tamsin, and I've really enjoyed it. I've come home with brilliant points that are definitely going to be put into practice, and I hope you guys have as well. Yeah, and I hope you've enjoyed it as well, Tamsin. As much as
it's been
really,
lovely
really
to talk to you. It's such a pleasure, Evie. Thank you.
Thank you so much. Well, thank you very much, guys. And I think our next live is the 6th of December. So scary. Where's the year gone? So we'll see you all then. Take care. Bye bye.
Night night.